Good afternoon, Madam Pro Temp and members. I'm Rohan Radhakrishna, Deputy Director at the California Department of Public Health, leading the Office of Health Equity. I'd like to first thank Governor Gavin Newsom for the incredible opportunity I've been provided to serve the people of California during this most important time in public health. I also want to thank the Rules Committee and your legislative staff for all your work in this confirmation process. Thank you to the 26 members of my office's advisory committee, to our community stakeholders, and to my dozens of staff who are so dedicated and pour their heart and soul into championing equity every day. Finally, a big thanks to all of my teachers, past and present, to my wife, Fumi, and to my family for their constant support. So I'm a dad with 2 wonderful kids. I'm a doctor with 10 years of experience at a local health department, practicing in a safety net clinic, and now a deputy director at the state level, but I most identify as a public servant and as a bridge builder. It's an unprecedented time for public health. This pandemic has exposed the issues that we have long known determine who lives and who dies, at what rates, in which zip codes. Those are the structural and the social factors that create disparities on our dashboards and inequities in our communities. As noted in the Cal Health and Human Services Agency strategic priorities, in order to create a Health of California for all, equity is the core value. We constantly pursue social and racial justice by not only lifting all boats, but especially those boats that need to be lifted more. And we prioritize prevention and the upstream factors that impact an individual's health and well-being. My top 3 priorities will be 1, advancing racial and socioeconomic equity, 2, climate action and resiliency, and 3, behavioral wellness, all to support an equitable pandemic recovery as we address California's overlapping existential threats that were outlined in the governor's January 10th blueprint. This pandemic has reminded us that health equity requires an all-of-government, all-sector, all-society response. Therefore, I aim to pursue these priorities with open communication and coordination between our many state and local partners, in addition to the stakeholders that represent the people we serve. Finally, I'm committed to my office's mission and vision, which is that everyone in California should have equal opportunities for optimal health, mental health, and well-being. I'm committed to creating a healthy California for all, and I want to thank the members for your time today. May we turn this equity moment into an equity movement.